Diabetes, medically known as diabetes, is a disease characterized by high blood sugar levels. This disease is divided into two main types, type 1 and type 2. Diabetes that occurs after the age of 60 is usually type 2. Type 2 diabetes occurs as a result of insufficient or ineffective insulin. At this age, the body's metabolism weakens, physical activity decreases, body weight increases, blood sugar regulation becomes difficult. If timely measures are not taken, diabetes can cause many complications. For example, vision impairment, kidney function impairment, nerve damage. Diabetes also increases the risk of heart attack and stroke. For this reason, it is important to keep your blood sugar levels under control after the age of 60. If you have frequent thirst, fatigue, frequent urination, or slow healing of wounds, take these symptoms seriously. Consult a doctor and have your blood sugar measured. One of the main indicators for diagnosing diabetes is fasting, blood sugar, and HbA1c analysis. The HbA1c indicator shows the average sugar level in the last 3 months. If this indicator is above 6.5%, the probability of diabetes is high. Lifestyle changes are essential in the first stage after diabetes is diagnosed. The nutritional regimen should be readjusted. Simple carbohydrates, white bread, sugar, sweet drinks should be removed. Complex carbohydrates, vegetables, whole grains should be included instead. Protein-rich foods such as eggs, chicken, fish should prevail. Food portions should be kept under control. Eating small but frequent meals keeps sugar levels stable. Daily fluid intake should be paid attention to, especially water. Carbonated and sugary drinks should be completely eliminated. Fruit juices can also quickly raise sugar levels. Physical activity is one of the main factors in managing diabetes. At least 30 minutes of light walking a day is recommended. This increases insulin sensitivity and reduces sugar. Physical activity also strengthens the cardiovascular system. Even in old age, exercise is possible, just in the right form. Whether it's walking at home or going to the park, each is useful. Drug treatment is also started depending on the situation. If lifestyle changes are not enough, the doctor may prescribe a sugar-lowering drug. One of the most commonly used drugs is metformin, but taking drugs on your own is absolutely not allowed. The dose, time, and combinations should be determined under the supervision of a doctor. A sharp drop in blood sugar, hypoglycemia, can be dangerous for the elderly. Therefore, regular sugar control is a must. It is important to learn how to use a home sugar measuring device, a glucometer. It is enough to check your sugar values in the morning and after meals. Keeping a daily record is useful for the doctor. Special attention should be paid to the feet. In diabetics, nerve damage causes a decrease in foot sensation. This can lead to delayed wound healing and infection. Wear comfortable, non-tight shoes. It should become a habit to check your feet before going to bed. Your vision should also be checked regularly. Diabetes can cause changes in the fundus of the eye, retinopathy. If timely intervention is not done, the risk of blindness increases. It is recommended to see an ophthalmologist every 6 months. Diabetes affects not only the body, but also the psyche. Being constantly under control is tiring. Therefore, support is very important. Understanding and help from family members and social environment create motivation. Stress can increase sugar levels. Breathing exercises, walks, and hobbies can reduce stress. A proper sleep schedule also affects sugar. At least 6-7 hours of sleep a day gives the body the opportunity to recover. Sleeping after 12 at night makes it difficult to regulate sugar. You should stay away from tobacco and alcohol. Both factors disrupt the balance of sugar in the blood. It also creates an additional burden on other organs. It is useful to consult a dietitian for a diabetes-friendly nutrition plan. Individual plans are more effective than ready-made diet lists. Drug-food interactions should also be taken into account in old age. If you are taking several medications, consult your doctor. Vitamin and mineral deficiencies can also make it difficult to regulate blood sugar. Vitamin B12 and D levels in particular should be monitored. Regular tests should be performed. Sugar, cholesterol, kidney and liver tests should be performed every 3 to 6 months. These tests serve as an early warning. In some cases, the symptoms of diabetes can be hidden. For this reason, preventive checks are important. Diabetes may not be reversible, but it can be controlled. Proper nutrition is vital in diabetes. Maintaining normal blood sugar levels is directly related to nutrition. The main goal is to prevent sudden increases in blood sugar. To prevent sugar spikes, you should stay away from simple carbohydrates. Simple carbohydrates include white bread, sugar, and sweet pastries. These foods cause blood sugar levels to rise rapidly. Complex carbohydrates are more beneficial. Complex carbohydrates include wholemeal bread, oats, and whole wheat pasta. These foods help regulate sugar levels because they take longer to digest. Vegetables are the main food group for diabetics. Low-starch vegetables such as tomatoes, cucumbers, cabbage, and spinach are especially recommended. Starchy vegetables such as potatoes should be consumed carefully. Fruits should be consumed carefully because they contain glucose. It is advisable to choose less sweet fruits such as apples, quince, and pears. Sweet fruits such as bananas and grapes should be eaten sparingly and rarely. It is better to eat fruits with meals than alone. Care should be taken in choosing fats. Trans fats and saturated fats are harmful to diabetics. Vegetable oils, olive oil, walnut oil should prevail. It is useful to reduce the amount of red meat. Chicken, fish, and plant-based proteins should prevail. Seafood is rich in omega-3 fatty acids and is beneficial. When choosing dairy products, prefer low-fat varieties. Unsweetened yogurt and kefir are good choices. Stay away from sugary dairy products. 3 main meals and 2-3 light snacks are recommended throughout the day. Meals should be taken in small portions and at regular intervals. Prolonged fasting negatively affects blood sugar stability. A light walk for 20-30 minutes after a meal is beneficial in controlling sugar. Tea and coffee should be taken without sweetness. Milk tea is not recommended for diabetics if it contains sugar. It is very important to increase water intake throughout the day. Carbonated and sweet drinks are completely prohibited. Alcohol should be limited for diabetics. Alcohol can cause fluctuations in blood sugar. When cooking, choose baking or steaming methods rather than frying. Salt consumption should be reduced, because excess salt leads to high blood pressure and kidney problems. Cook vegetables with a little water and a lid to save time. Add fresh greens to your meals. Greens are rich in vitamins and antioxidants. Vitamin deficiencies are common in diabetes. Pay special attention to vitamin D and B vitamins. Along with nutrition, it is necessary to adjust the time of taking medication to the meal regimen. Taking medications on an empty stomach sometimes causes sugar fluctuations. Get accurate information from your doctor about this. Planning the composition of meals in advance is important for sugar control. Pay attention to products containing sugar when shopping. Reading food labels should be a habit. Stay away from products with added sugar. For example, ready-made sauces, canned goods, sweetened yogurt products. Homemade meals are always healthier. You can control the composition of meals yourself. Consuming different foods every day is the basis of a balanced diet. Monotonous eating of the same foods can lead to vitamin and mineral deficiencies. The presence of fibrous foods in the diet normalizes intestinal functions. Fibrous foods improve the digestive system and help regulate blood sugar. Whole grains and legumes are sources of fiber. Legumes stabilize sugar levels. However, legumes can cause gas and bloating for those who are new to eating them. Therefore, the amount should be increased gradually. For diabetics, coffee and tea intake should not exceed 2 cups per day. These drinks do not replace water. Water is essential for the proper functioning of body functions. Try to drink 1.52 liters of water per day. Water helps to eliminate toxins from the body. Getting fresh air is as important as nutrition. Spending time outdoors every day ensures that the body is enriched with oxygen. The quality of the fats used affects the level of cholesterol in the blood. High cholesterol accelerates the complications of diabetes. Natural fats such as olive oil, avocado oil, and walnut oil are healthy choices. Avoid fried foods. If possible, cook foods in the oven, steam, or grill. Breakfast is the most important meal of the day. Pay attention to the balance of carbohydrates and proteins at breakfast. For example, whole grain bread, eggs, and vegetables are a good choice together. This balance is important for maintaining stable glucose levels. Choose nut products, such as almonds and walnuts, among light snacks. Nuts help regulate sugar. However, you should not overdo it, because they are high-calorie foods. The nutritional regimen of diabetics should be individual. For this reason, dietitian advice is important. Everyone's body reaction may be different. Proper nutrition is important both in disease management and prevention. You should measure your sugar level regularly. Observe the relationship between blood sugar measurement and nutrition. As a result of dietary changes, sugar levels stabilize. This also improves your overall health. Diabetics should also frequently monitor their blood pressure. High blood pressure increases the complications of diabetes. For this reason, both nutrition, lifestyle, and drug treatment require a comprehensive approach. Nutrition is not only for managing the disease, but also for preventing complications. A healthy diet reduces the risk of cardiovascular diseases. A proper approach to diet improves the quality of life. Physical activity is an important component in managing diabetes. Exercise increases insulin sensitivity. This helps to better utilize sugar in the blood. It is recommended to walk at a moderate pace for 30 minutes daily. If 30 minutes is difficult, this can be divided into 2-3 times of 10-15 minutes. It is important to consult a doctor before starting an exercise program, especially those with heart disease or other diseases should exercise under the supervision of a doctor. Physical activity also improves brain health. Until we meet in the next video.